Hello, I'm Mary Fowler, and I'm here today with Tim Briglin, who is the representative from my district in Norwich and larger to the Vermont legislature.
Yeah, thank you for having me today. I share a legislative district with Jim Maslin, and Jim and I represent four towns. We represent Norwich, Thetford, Sharon, and Stratford. And we are this four-town district actually straddles two counties.
Yeah.
Stratford and Thetford are in Orange County, and Sharon and Norwich are in Windsor County. So our district is called Windsor Orange 2.
Windsor Orange too.
Yes.
That has a certain cachet,
Yeah.
with like it's a color.
Exactly.
That's cool.
Yeah. No, it's funny. Before I ran for the legislature, there was a gentleman I know who's another representative who I won't name, but he, when he was talking to me about the possibility of my running for this seat in the legislature, he said that district is the best district in the state. And this district is, it's interesting for a couple of reasons. One, it is probably one of the most democratic districts in the state. If you look at the voting turnout and who people vote for in the state, it's consistently a very high Democratic voter district. And the other thing that's interesting is if you look at the voter turnout, extremely high voter turnout relative to other districts in the state. And in fact, last November of 2014, not a very high turnout election in our state, a non-presidential year, no Senate candidate on the ballot in 2014, and generally around the state, very low turnout. Not the case in Windsor Orange 2. It was actually one of the stronger turnout districts in the state. I feel very fortunate to represent these towns.
I'm going to assume what he meant by best in that context is that he appreciates the participation of the
Absolutely.
constituency.
Yeah, I think it's something we have to be proud of in
So
our
you
four
feel you
towns.
really belong,
Yeah.
not only in your district, but you're really carrying us with you.
Something that I've found in the 10 or 11 months that I've represented this district is not only do people turn out to vote, but people are very interested in participating in their democracy in terms of reaching out to their state reps and their state senators and making sure that we know what their opinions are. I get invited to lots of meetings around the four towns. I try to get to select board meetings in each of the towns and school board meetings, and am invited to energy committee meetings. And so it's a very robust civic level of enthusiasm. And I think people have a very positive kind of community-oriented view about their participation in government. And again, that's one of the reasons I think it's such a privilege to represent these four towns. And again, going back to this gentleman saying, you're so lucky to represent those four towns, I think it's one of the reasons why.
Yeah,
So,
well, that's kind of what I meant.
yeah, it's been energizing.
Well, that's terrific.
Yeah.
Well, one of the reasons I invited Tim to come and have this conversation is because this is his first year in state government.
Mm-hmm.
But it's not his first year. Well, and so I thought that was going to be interesting, what he discovered that he didn't anticipate about this. But you didn't start out in government here. You were an aide to Patrick Leahy.
Yes, that's correct.
You're very young.
Yeah, so it was roughly 25 years ago, in the early 1990s. I worked for Senator Leahy in Washington,
Yeah.
and I was his legislative assistant on budget, tax, economic issues, business issues, finance issues. And as I said, worked in his Washington office 91, 92, and 93, I believe. Did some work on his senatorial campaign in 1992, did some work on the Clinton-Gore campaign in 1992 as well. So, really got involved in politics for that short amount of time. And since then have been certainly involved politically. have been involved in Democratic politics in New York State, in Vermont, in the state, worked on a couple of Deb Markowitz campaigns, have done some work for Peter Welch, the Barack Obama campaign, and obviously Senator Leahy. So have had some pretty consistent political experience, but this is my first time running for and being elected to office.
Mhm.
So.
And certainly, your district, as great as it is, or maybe because it's as great as it is nothing like what DC could have been.
And it's very different.
It's a different experience.
Yeah, I think it's very
altogether.
different. Just certainly the scale is different.
You were following the numbers anyway.
Yeah.
You were in finance.
Yes. And the time that I was in Washington D.C., I think it was a very different time in Washington D.C. than what it's like there today. I lived in a house on Capitol Hill with 4 other congressional staffers, a couple of Republicans, 2 Democrats. We, and I don't think you see that kind of bipartisanship even socially today in Washington, from what I hear.
Mm.
So it was a time that I think where people were, working more closely together than what you see in Washington today. It's also a time I met my wife. My wife, Laurel Mackin, worked for Bill Bradley, who was a senator from New Jersey. And we met. We actually played on the same softball team. Laurel played on the Leahy softball team, which is how we met. And
That's a great story.
yeah. And we were married in 1995. So it was a Capitol Hill marriage.
Yeah, that's wonderful.
Yeah.
Well, so when you got to the legislature
Yep.
then this past January,
Sure.
what did you find?
Yeah. So I have worked with people kind of in a political context in Montpelier for years. I've worked on a couple of state boards that the governor had appointed me to. So I was not new to Montpelier.
Okay.
But obviously sitting in the chair and being a legislator is kind of very different than watching it from the outside. A couple of things I think are important to understand about the context of being a state rep and working in the state house. One is that each state legislator is appointed to one committee. There's only one committee you serve on, unlike in Congress where a senator or a congressman might serve on 3 or 4 different committees. But in the state house, state reps, there's 150 state reps. Each state rep serves on one committee. I'm sorry to say I can't say exactly the number of committees, but there's a dozen, maybe 14 committees. Each committee has 9 or 11 members. Most committees have 11 members. And I was appointed to the healthcare committee, which I was thrilled with. There's a lot of important things going through the healthcare committee now. Healthcare is an issue. Not only is it very important to the state, it's very important to our district. There are a number of doctors and nurses and employees of kind of the medical community, whether it's the VA in White River Junction or Dartmouth Hitchcock Medical Center. So it's an important policy issue and it's an important local issue for this district. So it's a great place to be. A lot of things going on there. So the Speaker of the House, Shep Smith, appointed me to that committee. The Speaker appoints every member of every committee.
Kidding.
So it's the Speaker in the Vermont House of Representatives is a very important position, very powerful position. The chairs of each committee, again, unlike in Congress, are not determined so much by seniority, although chairs of House committees typically do have more seniority. They typically have been members of the House for a longer period of time, but you don't necessarily ascend to a chair position in a committee simply because you're the longest serving member on the committee. But the chair of my committee is a fellow named Bill Lippert, who has served in the House, I believe since the early 1990s. He's from Heinsberg, and this is his first year on the healthcare committee.
Oh, no kidding.
And he was brought over to the committee to be the chair. He, for a number of years, had been the chair of the Judiciary Committee. So I spend a great deal of my time on the Healthcare Committee. For the time that I'm in the building, I would say that 80% of my time is spent in the Healthcare Committee working on healthcare issues, whether it's legislation we're considering, whether it's testimony that we're taking from witnesses who are either government officials or people from private industry, doctors, insurance, folks from the insurance sector, people who are executives in the kind of the hospital world. But those are people who are coming to our committee to speak with us about legislation we're considering, and then, as I said, the rest of the time we're working on particular bills.
So that concentration
Mm-hmm.
is not necessarily usurped by the single payer system.
Yeah.
Or how much, is that considered in the can and you are doing refinements
Right.
on something
Right.
else? Or
No, so that's a great question, Mary. Even before I was sworn into office, Governor Shumlin had decided that he was going to pull off the table his plan for they called it universal care, but a single payer system in Vermont, which his administration, to some extent the legislature, but more the administration, had been working on for a number of years. And to some extent that took a lot of air out of the balloon before I'd even been sworn in to my seat. So there were a couple things that we worked on last year that are setting the table, not necessarily for single payer, but are going to be some things that are going to move us in that direction. But there are a number of really big issues that we've got to grapple with in our state, I think. One that we were unsuccessful working on last year, but it's going to be a very important issue again this year, is how to work with what's people talk about it as a cost gap between, and this is going to get a little granular in terms of the policy, but about 30% of Vermonters receive their health care or some portion of it through Medicaid, mm-hmm. which is a joint federal-state partnership. It's a program whereby lower income folks are able to get health insurance, essentially. And it's a great program because without that, a significant number of Americans, a significant number of Vermonters, lower income Vermonters, would have no access to health insurance and would not be able to see a doctor. Medicaid allows people to do that and to pay for a portion of their medical care. The problem with our Medicaid system, and this is going to be a huge issue this year, it was a big issue last year, is that the federal government and the state together, when they pay for low-income health care and pay doctors, they don't pay $1 for every dollar of care that doctors provide. They actually pay about 50 cents. So when a doctor sees someone who is a Medicaid patient and they provide care that costs them $200 to provide, they lose money. They don't get paid $200. They get paid about $100. And so doctors lose money seeing Medicaid patients. But doctors aren't going out of business because of Medicaid patients. What they do is they shift those costs to people who get health care and pay for it with private insurance. So while a doctor might lose $100 on seeing that Medicaid patient, I have my health insurance through MVP, which is one of the insurers that covers Vermonters. So when I go see a doctor and get $200 of medical care, the doctor doesn't charge me, or MVP, my insurer, doesn't charge me $200. I get charged $300 or more.
I had no idea.
So that doctors can make up for the losses that they have in treating Medicaid patients.
Well, no wonder.
So that's why
There's a
health insurance
cry.
rates for people who are buying their insurance through MVP or through Blue Cross Blue Shield or another private insurers, why those rates are going up so quickly, because they are making up for the losses that hospitals and doctors are taking in treating Medicaid patients. And it's because the state of Vermont and the federal government doesn't pay for the full cost of those low-income individuals. So it's a...
And my guess is that with that new legislation, that more low-income people are coming into the system because they weren't before.
Yeah.
So that
Yep. So
ups that ante all the more.
yeah. So one of the things with the Affordable Care Act, which went into effect a couple of years ago, 3 years ago, I believe, is that it's allowed more low-income folks to get health insurance,
Yes.
to get medical benefits through the Medicaid program, which is good. I mean, previously those
Right.
folks were getting none
Yes.
or very little, or really deferring medical care to a point where it was very expensive to provide that emergency medical care, or their medical condition had gotten so severe that it had become quite expensive. That was a very inefficient and ineffective way to provide medical care. So it's a good thing that more people are able to access Medicaid benefits. But you put your finger on the issue, which is with more people getting Medicaid benefits, this cost shift that I had described,
Right.
whereas doctors and hospitals losing money on those patients, that shifts the costs onto the private system.
And those people who have the Cadillac, is yours a Cadillac?
Yeah, so that's a different issue. It's not.
Oh.
It's not.
All right.
No, but so we
don't-
can go deeply into that issue. But that is you put your finger on a big issue that the healthcare committee is going to be dealing with. Tried to unsuccessfully last year. The governor had come up with an idea as to how we could address this. It's still an issue out there that we have to address, and
And the small businessman is one that gets hit
very much so.
very hard.
Very much so. Well, and all Vermonters, I will say. You could say the small businessman, absolutely, but also school districts. School districts provide health insurance for their teachers and for staff, and those are typically privately, private companies. Again, health insurance provided by Blue Cross Blue Shield or MVP, in some cases Cigna. But those are private insurance companies, and those rates are going up faster than actually the cost of healthcare. The cost of healthcare, actually, the inflation in the cost of healthcare has moderated in recent years. But the reason insurance rates are going up faster is because we've got this cost shift going on between Medicaid and actually it happens with Medicare as well. Medicare is a federal system. It's only federal. Vermont doesn't provide money for that, but it's federal health insurance for seniors, for people over 65. But there's a similar cost shift related to Medicare. It's not quite as severe, but doctors who treat Medicare patients, it's not quite as severe as they only get reimbursed 50 cents on the dollar, but it's it's in that kind of 60 to 70 cent range. So doctors lose money on Medicare, treating Medicare patients as well. So it's not a...
And is that shifted?
Yeah.
That,
Yep.
to make
And that
up
also
for that?
falls on the private insurance system. So again, one of the reasons why it's very frustrating for people, myself personally, and my company, but it's very frustrating for people who are somehow involved in the private insurance, purchasing private insurance, whether it's a company or an individual, and why those rates are going up so quickly. It's because it's covering the costs of people who get their insurance through Medicaid and through Medicare.
You are representing us as a Democrat. And so I assume that you are persuaded in some degree that our free market system needs to carry those people in that way.
Well, just to step way back, I am a fan of having a universal healthcare system in our state, in our country.
Because the bottom line is people would not thrive without them.
Well, and I will say that if you'd asked me 20 years ago, if I thought a universal healthcare, a single-payer healthcare system in our country was the way to go, I think I would have been more skeptical. I think the demographic shift we've had in our country, very much so in the last 5 years, 10 years, where we have an aging population, we have a poor population. As I said, 30% of Vermonters now receive Medicaid benefits. That's a huge percentage of our population. I think there are real economic benefits to having everyone insured in one pool. And we have examples of that in our country. The Medicare system, again, federally. So it's, people have raised concerns about such a small state as Vermont taking on universal health care. And there are definitely some challenges of that. There are benefits of having a system that has scale. When you're talking about Medicare, you're talking about, I don't know how many Americans are on Medicare, but if it's not 100 million, it's close to that. It's tens of millions of Americans are in the Medicare system. But one of the things about a single payer system that has advantages over the private system that we have is with a single payer, administrative costs are significantly lower. In Vermont, we actually benefit from having a Blue Cross Blue Shield company in Vermont that actually has pretty low administrative costs for a private insurer. Still, if you look at the Medicare system, the administrative costs in the Medicare system are probably half even of what our private insurers are in Vermont, who, as I said, are pretty good for the private sector.
Because the costs are better for Medicare than the private.
Well, I'm just talking about administrative costs.
Yes.
Even set aside how much does it cost, in the Medicare system to charge for an appendectomy.
Right.
Even that aside, if you just look at the administrative costs, paperwork costs, how much it costs to keep records on who's getting care, they're much lower in the Medicare system.
Because
you have a single payer.
And that means there's less tiers of ways that you have to bill and think through.
Sure.
That's the administrative
if you
task
think about
that gets simplified.
Absolutely. It's a much simpler system. But it's a big step from where we are right now. I will acknowledge that, and Governor Shumlin, I think, came to that conclusion a year ago. It would not surprise me if in the next 10 years we get to a single payer system in Vermont and maybe even more broadly. Sadly, I think what's going to take us there is crisis in the cost of what we pay in the state for medical care. Again, I think we can insure the people that we insure in our state through a private system less expensively if we do it in a public single payer format. But I don't think that's going to happen in the next couple of years. And
what happened? How did the resistance get voiced, or who, or what's in that?
I think that there was some sticker shock last fall when there was a realization, it didn't surprise me terribly, but that in order to fund a single payer system, there was going to need to be an institution of a payroll tax on both employers and employees that was going to be in the high teens as a percent, so 16, 17, 18%. And it depends on how generous a healthcare plan everyone would have that would determine how high that payroll tax would be. But and I think there was real sticker shock for that, and I understand that. Part of that is, I think, an education that we need to have and a discussion we need to have as a state as to how much does your healthcare currently cost. And I don't think people have a real awareness of that. But the next time you go to a select board meeting or to a school board meeting, ask one of your town select board members or school board members about the healthcare plans that once a year when they put their budgets together, how much those cost. And if you look at them, for a teacher who is making $50,000 a year and has has their family insured through a health insurance system that the school district purchases, that a silver health insurance plan is probably going to cost somewhere in the $1,200 a month. Right? So you're talking
fully as much as your rent.
Well, so you're talking to insure that teacher and their family. You're talking about $14,000 to $15,000 a year. Okay, so this is a teacher that makes $50,000 a year. So $14,000 to $15,000 a year on top of that. That's what, 28 to 30%. So again, what Governor Shumlin was talking about last year was we can't afford as a state a payroll tax of 17, 18, 19% of your payroll in order to fund your health insurance plan. But what I would ask people to do is, well, look at what the health insurance plans that you have now are. Take the cost of that and divide it by the salary for that employee. And you get, it's, again, I gave the teacher example, but for an average salaried employee, it's a pretty high number. It's a pretty high number. So I guess my point is, I think we are going to get to a point of crisis in this state. And I don't know if it was Rahm Emanuel who said, never let a good crisis go to waste. Mm-hmm. Sadly, we're going to get to that point.
And the crisis will be? Or?
We can't afford this. Is there a cheaper way to do this? And again...
I mean, the people who have private insurance will see, I got a problem here.
Yes, and it's, again, whether it's the school board, whether it's the select board, whether it's
off the rolls.
Or what's happening is businesses, schools are ratcheting back the type of insurance that they are telling their employees they can afford to pay for. Mm-hmm. And so
that's a crisis.
It's a crisis, and so what you have is you have employees who are saying, yeah, I have health insurance, but whereas 10 years ago I used to pay for 15% of my health insurance costs, what my employer is telling me today, again, whether it's the school board or the small business, is telling me now that I have to cover 40% of it. Mm-hmm. And not only do I cover 40% of it, but the health insurance plan that I have, it's a very high deductible plan that not only do I cover 40% of the health insurance premium, but also I've got to go out of pocket for the first $5,000 of health costs that I have before the health insurance plan even starts to cover anything. Mm-hmm. So these are getting really expensive, and that's gonna continue. That inflation is going to continue to happen because of this cost shift thing, and those issues are not going away.
And if your employer enrolls you, I guess you have an option of whether you accept it.
Sure. Yep.
But it'll be interesting is how many people say, well, I'm young and I'm well and I don't need this, you take it.
Well, and under the Affordable Care Act, you don't have that choice. You either have to purchase a health insurance plan, or you can pay a penalty, which frankly would be less than the insurance plan, but then you don't have any insurance.
Yeah. Well, I guess that's what the cry has been about.
Yeah. That people don't have that choice. But again, as a society and as an economic matter, I think we might be at that tipping point now, but I think we are going to get to a tipping point where the type of health insurance that people have is it's going to be increasingly obvious to people how expensive that coverage is. Whether you talk about you define expensive as the premiums I pay, or the percentage of that health insurance that I pay relative to my employer, or the escalation in the deductibles that are part of that plan. There are a number of ways you can kind of slice and dice defining expensive, but there's no way around our health insurance plans are getting much more expensive. And it's that crisis is
Well, I think we're glad that we have you on that committee.
Well, we haven't solved it yet, but again,
I guess
those are big economic
that's
issues for our
coming
state. Healthcare and health insurance isn't just it's not just a healthcare issue, and there's certainly a moral component as far as I'm concerned, but it's also a huge economic issue for our state, and so again, it's a reason I'm interested in the issue. Yeah.
Well, let's just slip away a little bit and talk about your other life.
Yeah.
Because you're a founder of Tuckerman Capital.
Yeah, that's right. So.
What do you do there?
So 20 years ago, not quite 20 years, that was 17 years ago, I was working in a private equity firm in Vermont with a partner of mine, Peter Milliken, who's a Norwich resident, and we left this company to start our own investment firm, which, as you said, is called Tuckerman Capital, which we started in 2001. And what Tuckerman Capital is it's an investment fund where we have raised money from some large institutional investors, some wealthy individuals who have entrusted us with money to invest on their behalf. And how we invested is we looked for small manufacturing companies to invest in, American manufacturing companies. And in the last, since 2001, we've invested in 19 or 20 companies, and they're all over the country. Unfortunately, I wish I could get in my car and drive to visit with these companies and to attend board meetings and to work with the management teams. But they're all over the country, so we fly around the country quite a bit. So we invest in these companies. We usually, maintain our investment in that business for anywhere from 3 to 11 or 12 years. I think the longest investment we held, 14 years. The very first investment we made at Tuckerman Capital was in a company in Minnesota in 2001, and we just exited that investment this past May. So we're long-term investors. We kind of look to Warren Buffett for inspiration. He's kind of the classic value investor that looks for companies and investments that we think are undervalued, and then we work with those companies for a number of years to try and improve their operations, and that's my day job.
That's exciting.
Question.
So how do you manage your time and the burdens that you take on between the state, we citizens, and that very exciting role?
There's a lot of time management work that I found in being a state legislator. Between the beginning of January and say mid-May, I probably spend 70 to 80% of my time doing legislative work, mostly in Montpelier. I spend 4 days a week in Montpelier, Tuesday through Friday. And what I found this past winter is that on Mondays I'm in the office at Tuckerman Capital working on my day job. And as crazy as it sounds, I found that working on Tuckerman work, I would usually do that in the weekend, get up early, go spend 3 or 4 hours in the office, and kind of get home before the kids get up. And I found that to be very productive time. There's no phones ringing, it's on the weekend. So I could be very productive on those Saturday and Sunday mornings, and then get home to have time with my family. So that worked well. The calendar kind of shifts starting in kind of mid-May when the legislature is no longer in session, and my life turns much more back to Tuckerman Capital at that point. And then my legislative work is more geared towards constituent service and going to select board meetings and school board meetings and working with people on more local issues. So the legislative year I found is kind of divided into 2 parts really. It's kind of my time in Montpelier, And then, the rest of the year when it's more geared towards constituent service and, doing my job that puts food on the table. So.
Well, it's very impressive, and I'm sure we're very glad that it interests you and
Yeah.
that you want to do it.
Yeah, it's very exciting stuff. So.
So maybe you want to give a contact information?
Sure, absolutely. And I'm happy to hear from people. I give people my cell phone, which reaches me pretty much anywhere except at home, where we don't have cell phone service at my house.
Oh,
But
I thought you were going to say you turn it off.
No.
We turn it off.
But my cell phone number is 802-384-8256. And I have a website that I send people to, which Jim Maslin and I maintain together. And the website for that is, it's just jimandtimreport.com. So people can go to that and find information there.
Terrific. Well, thank you
Yeah.
very much.
Thank you for
sharing
inviting
all
me.
of that.
That was fun.